I am Joseph R. Kraft, Chairman Emeritus of the Department of Clinical Pathology and Nuclear Medicine of St. Joseph Hospital, Chicago, Illinois. The subject of this video is extremely important. It's called penile erectile dysfunction. Now, my first reference, you might wonder why I'm doing it, but here it is. Abe Encienza, who lived from the year 980 to 1037, was a prolific contributor to international medicine. He was such a wonderful writer and teacher that his writings and journals were part of the medical curriculum of all the medical schools of Europe at that time. Now, this Arabic physician described two complications of diabetes: gangrene and sexual dysfunction. Both conditions prevail in the diagnosed and undiagnosed diabetic population. Now, it's been estimated that his writings on erectile dysfunction was about the year 1000. So we know that penile erectile dysfunction was prevalent over 1,000 years ago and must have been prevalent even before Encienza described it. So it's not a new condition. Now, sexual dysfunction is of grave concern today to both men and women. Penile erectile dysfunction is a physical manifestation of hyperinsulinemia type 2 diabetes. PED, heart disease, high blood pressure, retinopathy, and Peyronie's disease are prominent clinical pathologies of hyperinsulinemia type 2 diabetes. Peyronie's disease is penile atherosclerosis of the corpora cavernosa with a rectal curvature. Now, locker room camaraderie may hail rectal curvature as a desired achievement, and patients rarely mention this condition to their doctor. Now, the correlation of the hyperinsulinemia pathogenesis of penile atherosclerosis with the hyperinsulinemia pathogenesis of systemic arteriosclerosis is lacking in medical communities worldwide. The marketing of Viagra and Cialis is extremely successful. According to Fox News, each pharmaceutical company acknowledges 20+ million users. Just as in the time of Encienza, each one of the 40+ million users must be considered diabetic until proven otherwise by oral glucose tolerance with insulin assays. PED is a clinical pathology of hyperinsulinemia type 2 diabetes, even those with blood sugars considered normal. Until proven otherwise by oral glucose tolerance with insulin assays, PED and all other clinical pathologies of diabetes, which is mainly heart disease, hypertension, retinopathy, and Peyronie's disease, are hyperinsulinemia type 2 diabetes. The pathology of diabetes begins when blood sugars and glycated hemoglobin are normal. The very earliest laboratory diagnosis of diabetes is neither by fasting blood sugars nor by glycated hemoglobin, but only by insulin assays with normal glucose tolerance as infirmed in this text. This text consists of 14,363 oral glucose tolerances with insulin assays. The silent diabetes epidemic will be arrested and then reversed when physicians and patients demand the earliest laboratory diagnosis and treatment of diabetes. Until the earliest laboratory diagnosis of diabetes becomes a standard routine procedure, the worldwide clinical silence of diabetes will continue to remain an enigma of clinical medicine. Thank you very much.